because the breast milk has specific fatty acids which are good for baby's brain growth.
Absolutely. And it has been proved that the IQ
So,
goes by 8 to
breast
9
milk is
points in
ideal.
people who are
It has
exclusively
got the
breastfeeding.
ideal nutritional requirements of the baby. It provides, so it's better for the better weight gain.
Right. Next question.
It protects against the postpartum depression. Dr. Ramaraju, have you have any comments?
Yes, it's true, madam, because it builds it builds the rapport between the baby and the mother. So because of that psychological.
And does it have any effect on the uterine contractions also?
Yes, of course, because of its oxytocin secretion. Suckling reflects increased oxytocin secretion, and it has got contraction on the uterine.
The next question is, the initial thick yellowish discharge should be discarded.
Absolutely no, ma'am, because colostrum is very important for the baby. It has immunoglobulins, antibodies, which actually helps the baby to fight against infections.
Next question.
A baby should be on the breast for a few minutes on the right, the few minutes on the left, and you have to see the clock. Is it true or false?
Actually, this is absolutely wrong practice. The first breast should be completely emptied, then only switch over to second breast, because the foremilk and hindmilk, these are the two components of the milk which are very important for the all-round development.
If the baby has diarrhea and vomiting, mother should stop breastfeeding.
Absolutely no. In fact, breastfeeding will help the baby to recover from diarrhea and vomiting. There are IgA antibodies in the breast milk which provides a protection in the intestine of the baby. So there will be a protection from the pathogens, and hence the diarrhea will be controlled.
Absolutely.
What's your opinion about the feeding gowns and feeding bras for breastfeeding?
No, nothing. Oh, sorry.
Yeah, next. Yeah.
Next.
It's not necessary at all.
Does it causes any harm? Next, yeah. The
Can I
feeding
comment?
gowns and feeding bras.
Would you recommend as an obstetrician to your patient?
The feeding bras and feeding gowns.
Not necessary, but they can wear, but it's not necessary to wear always feeding bras.
I think feeding bras and feeding gowns should not be recommended. They should be
No
condemned.
special dress required.
Yeah, because skin to skin contact is very essential for the baby and the mother, because it stimulates the reflexes. So skin to skin contact is very important, and feeding bras and feeding gowns should be
Absolutely
condemned.
not required.
Yeah, not required.
Nipple should be clean before each feeding. Dr. Mangla? Okay.
No, not necessary.
Why?
Because it's always clean, and usually when the baby sucks it, baby is also sterile, baby's mouth is also sterile, so it's not necessary to clean every time.
Mangla, do you want to comment?
Breast milk is also as such anti-infective. It should not be cleaned every time.
Every time
If you clean the nipple every time, nipples are 1,000 times sensitive than the non-pregnant stage, and it causes pain and it causes cracks in the nipple. So don't touch nipple. And
Don't remove the oily substance which is present over the areola.
Yeah, while cleaning, it removes the skin, the protective layer, the oily layer which is there on the skin of the nipple and the areola. You remove that. So it's very harmful. So it should not be encouraged.
Hind milk can be used to clean the nipple.
What?
Hind milk can be used to clean the nipple after the session.
That is also
Actually, when there is cracked nipple, then hind milk is used for the repair of the cracked nipple, because it contains
keep the hind
fats.
milk there only, yeah. But don't touch.
So basically, we don't need to clean it every time you are feeding a baby. The next question is, contraceptive use is harmful in breastfeeding. Who would like to take this question? Yes?
Actually, estrogen in the contraceptive, it inhibits lactation. So unnecessary giving contraceptive combined pills. We can give only progesterone pills, but that may again cause areolar edema. So better advise postpartum copper-T. Nowadays we introduce copper-T during cesarean as well. And even postpartum copper-T is advised.
Want to have a copper-T inserted?
So breastfeeding is still be lactation and amenorrhea method, 6 months exclusive breastfeeding.
Follow LAM,
yeah,
right?
lactation.
And any other contraceptive you would like to prescribe? Centroman. Can it be given immediately after delivery? Can it be given immediately after delivery? How about Dimpa? Injectable?
weeks, 6
After
weeks,
6
6
weeks.
weeks of delivery.
So there is a basket full of contraceptions which a woman can use even if she's breastfeeding. So it's a myth that if she's breastfeeding, the milk will dry up, it's going to be harmful for the baby. We have lot of cafeteria approach for breastfeeding women also. Does the nutritional composition of breast milk change?
No.
Yes,
no.
it does.
Only it is the fore milk and the hind milk. That is different. One is more in protein and the other one is rich in fat. Otherwise, it doesn't change with time.
No, it is very changeable.
It changes, madam, as per the
It's a
demand of the
taste.
baby.
It's a
Does it change with
tailor-made.
the age of the baby?
Preterm babies have more breast
Yeah,
proteins
yes,
because for
yeah,
the growth of the
exactly.
baby it is required. So as per the demands of the baby, the composition changes.
The colostrum is different, the first milk is different, the transient milk is different, the mature milk is different. So the milk changes its composition.
Yes, ma'am, and the composition as well as
Hello.
it is said that if the baby feeds at night, because the prolactin secretion is more at night, so the diurnal variations are also there.
So the fore milk is high in protein and lactose, the hind milk is rich in fat, there is a transition milk, and then there is a mature milk also. So the quantity and the quality of the milk is changeable.
So we continue with our panel. 4 days postpartum, mother and relatives are really very worried that enough milk is not coming. So what is your advice and your prescription?
Initially, the colostrum is always small in amount, but it is enough for baby. Also, the baby's stomach is very small, like the children play with the marble, so it is just 5 to 7 ml. And slowly after 4th and 5th day, the milk supply increases. So we have to do lot of counseling and explain the mother that even if the milk is small in amount, less in amount, it is just a frequency. The baby has to be breastfed whenever the baby is hungry, or at least every 2 hours. Automatically, the more milk will subsequently
Would you
come in.
advise her that the initial few days she can continue with a little bit of powder milk or maybe cow's milk?
No, because once the powder milk or the formula is given, the baby will not be at the breast and the baby may refuse the breastfeed. And
Dr.
then
Dolly,
she will
would you
not
like to
have
add on
milk.
something?
Nothing is needed except for feeding the child again and again to improve the breast secretions. No galactagogues or any prescription is needed for this to improve the supply of the milk.
We can just counsel the, okay. No
On the
need.
contrary, by giving powder milk, we will inhibit the initial reflexes, which is very essential for the mature milk formation, abundant milk formation. So never advise powder milk, any formula, to the neonate.
If you advise powder milk, you are trapped
Actually,
in the top up trap. And here you can see the vicious circle which is there. If you advise, if you give the powder milk, then the baby will be having a full
Baby
stomach.
Full stomach, baby
And
will
he
not
will
go to
sleep.
the breast, the mother will stop secreting less, and then she will go into that vicious cycle of less milk and no milk finally.
And mother-in-law is always happy. See how fantastically he is sleeping. So that's not the thing. We should not do that.
Actually, stomach will not be emptied because of the powder milk.
Yeah,
And so the vicious
exactly.
cycle will start with that.
Ek minute.
Would you
Where's the
like to
question?
comment something on galactagogues? Is it indicated? Not in this case, otherwise, do you recommend
Actually,
galactagogues?
We can only advise rich diet, otherwise it's not necessary to give galactagogues.
Many dietary constituents or herbal preparations are used as galactagogues.
Can you name a few which are commonly in use? Some pharmacological agents or some.
Yeah, these are lactonic granules. These
So
are
do you think your patients are benefited from them?
not necessary. I think they should be advised to take rich diet, protein-rich diet, fat-rich diet, and this is sufficient to increase the milk secretion.
And how about methi and ajwain and
Yeah, these are helpful. I think these are helpful. Even sabudana, I don't know what's the English word, but these are helpful.
Shatavari, the n number of
Shatavari,
products which are available in the
ginger,
market.
Mostly
these are, I
they-
think, helpful. They can increase some amount of milk
Mostly
secretion.
it
But,
helps.
but
It's
there
just
is
a
no
placebo
quality,
therapy.
good quality evidence
There is no evidence
in
regarding
support
this.
of these
Mostly they
galactogogues.
just act as placebos only.
Actually,
Yeah.
injection Pinargan,
So let
Perinom
us-
can be given. Injection Perinom sometimes in resistant refractory cases. Some placebo effect is also there and it can increase milk supply.
So what is
But
the dose?
fenugreek and those Shatavarix and all those things, they are herbal. We respect Ayurveda. But since there is no evidence as such, so
Yeah.
we practice evidence-based medicine. So we should never advise those medicines which don't have research.
In fact, American FDA doesn't approve anything as a galactogogue.
And
There is nothing. Australian, they
Australian
just
does say that domperidone can be used, but that's in very, very restricted and limited cases where there is no lactation at
Generally,
all.
very
And-
lactation cases and induced lactation cases, we go for domperidone.
Yes. Suddenly, my 3 months baby has started demanding more milk, has become cranky, clinky, fussy, and unsettled, and has disrupted nap times and night times.
It is growth spurt.
What has happened?
Baby
and what
has
do you
suddenly
really need to stress
It
on?
is growth spurt, and suddenly baby has started growing faster, and that's why these are symptoms.
So how do you counsel this mother who is really worried?
There'll be always, when there is a growth spurt, the milk secretion increases on its own. So you don't have to bother much about it, or you don't have to take any medication regarding this matter. The baby is going to feed, the breast milk will increase, and then accordingly it can be dealt with. But you don't require anything to be done for this.
Would you
This
like
is
to add
the
something,
moment
Dr.
when,
Vanna? Would you like to add something?
actually this is very crucial moment in that breastfeeding history. Because that only point can mislead the mother that her milk is not sufficient. And she may switch over to top milk or formulas. So counseling, as madam has said, very important role.
The most important role is counseling here. You have to sit with the patient for at least 10 minutes to explain what is growth spurt. Otherwise, this mother will never continue with the breastfeeding. Something will come inside like powder milk or cow milk that will become a part of her habit at this point of time. This is a very crucial period.
powder milk has just the right amount of required nutrients, and then why to choose the breastfeeding? Any comments, Mangla?
Yeah, the powdered milk is ultimately it is the cow's milk which is powdered, and the milk is very specific. So the cow's milk is made for cow's baby. So do we think like our baby's brain should grow like cow's brain? Because that milk is made for cow's baby. So even if the formula does lot of advertising that it has all the nutrients the baby requires, but it doesn't. In fact, many times wrongly it has the wrong things in that.
There'll be no emotional connect between the mother and the baby.
And do you think the composition of the
Rich in
powder milk or cow's
immunoglobulins.
milk is also different?
No, mother's milk is rich in immunoglobulins, so we can protect the baby and give immunity to them by giving mother's milk. It is not available in formula milk.
It contains,
And
yes.
temperature is very proper. If
So it is available at the right time, right temperature, safe, hygienic. Whenever the baby requires it, it's available to the baby.
No preparation
unlike the
required.
powder milk.
No preparation time
No
required.
preparation time is required.
Instantly available.
DHA content, which is very important for brain development, IQ we say, and emotional bonding. Nowadays it is number one advantage of breast milk, mother's breast milk, emotional bonding between the mother and the child, because that will reduce stress and everything. Apart from long-term benefits like diabetes, blood pressure, brain hemorrhage, stress-related problems, obesity, all these things will be increased by powdered milk or animal's milk. We have not seen cow's बच्चा human being का milk ले रहा. कि हमारे यहाँ तो सुपर कंप्यूटर दिया है भगवान ने कि हम पाउडर मिल्क के पीछे या काउज मिल्क के पीछे भागते हैं.
Here I would also like to add the amino acids which are present in the breast milk are totally different than what they are present in the cow's milk. So the cysteine level which is present in the breast milk is actually very good for the premature babies, unlike what we get from the cow's milk. And do you want to add that our pediatricians are very fond of giving drops, iron drops for the, do you suggest that this should be given or not given?
Unless and until it is real prescription by a pediatrician, we should never advise any types of drops because mother's milk contain everything. all vitamins, whatever is the requirement of the baby, unless the baby is too IUGR or some, their problems with some particular vitamins, then only pediatrician should advise. Otherwise, there was a system previously, right, Abdec drops, vitamin is so and so drops. No need to give any vitamin drop.
What is there in the breast milk? I would like you to tell the audience that we should not give iron drops, and that's present in
Vitamin
the
A is very important. Immunoglobulins are important, and
lactoferrin is present in the breast milk,
yeah,
which
that is
promotes
very
the
important.
bioavailability of
Yes,
the iron.
yes, yes.
And do you think we should give some calcium supplementation because breast milk is deficient in vitamin D?
No, not at all. The mother is with good calcium storage. Breast milk is never deficient in calcium or vitamin D.
Dr. Mangla, would you like to add?
mother-
What type of vitamin D is available in the breast
Yeah,
milk? Is it
vitamin
the-
D supplementation is recommended because the breastfed babies may get vitamin D deficiency.
No, anybody would like to differ with her?
If required, it means that they will calculate the amount, whether it is really required or not. Empirically, we cannot give to all babies vitamin D or calcium.
A full-term baby does not require vitamin D supplementation
No, there
because
are
the
in
breast
fact-
milk has water-soluble vitamin D,
There are
which is
some
more than
data
enough for the
recently
baby.
showing that it may be little vitamin D deficient.
The little bit of vitamin D, if the mother
But
was
other
deficient
vitamins
during
are not
pregnancy,
needed.
can be taken care by the exposure to sunlight. That's more than enough. No need to supplement the baby with vitamin D.
So they are saying the time is less, so we have to rush. So the literature is flooded with scientific evidences on the benefit of the most natural process of the mother breastfeeding her baby. Exclusive breastfeeding is in the first 6 months of the life can cut down the under 5 child mortality by 13 to 15%, and there could not be any more compelling reasons for breastfeeding the baby. Now, coming to some of the clinical tales. These are all real stories. Susan is a staff nurse, delivered a preterm baby at 28 weeks. We have kept her baby in nursery for at least 3 months. The Shikha is exclusively breastfeeding her 2 months baby. She has to undergo dental surgery and will be in hospital for 24 hours. Then Soumya has a very bad migraine, usually precipitated by the lack of sleep. Her baby is 1.5 months and having growth spurts, and her nights are now becoming nightmare for her. Rosa is a single parent, and her mom looks after her baby, and her working hours are very long. So what is the solution for all these? Can anybody tell?
Expression of breast milk.
Yeah, exactly.
Repeatedly, it can be expressed and stored. It remains for 6 to 8 hours at room temperature.
Yeah.
And if it is a freeze, human milk bank can be accessed. But even that mother's breast milk is stable at room temperature for 6 to 8 hours. If it is kept in freeze, 24 hours. If it is kept in deep freezer, 3 months. So if we frequently express the breast milk, it can be made available to all those babies. Secondly, whenever there is human milk bank, again she can, human milk bank, the processed milk can be made available to the baby.
So you mean the breast pumping is now bridging the motherhood and the work. Does anybody know about the power pumping?
You would like to add about power pumping?
They do have these power pumps available, but then these are to be used only in specific conditions like preterm babies or the night.
No, Rosa. Power pumping is something different.
Yeah, you collect milk every hour for some time, and the 24-hour.
No, when the mother is lack of time, is having not enough time, so we can ask mother
within 1 hour you can
within
pump
1 hour,
the milk.
pumping
2 to
is
3 times.
simultaneously done from both the breasts for 20 minutes continuously, and then there is a pause of 10 minutes. Then 10 minutes pumping, and then that is followed by 10-minute pause. So in all the 40 minutes, one can pump enough milk
For 24
whole
hours
day
requirement
or
of the
whole
baby.
week also. So this is power pumping.
After the breast, just one question I would ask you, because this is very relevant. You were talking about storage of breast milk. So once the mother has taken out the milk, stored and then thawed the milk, after how many hours can she discard the milk the baby has not taken?
Actually, 6 to 8 hours at normal temperature, she can discard the milk, especially in summer when the temperature is high. Secondly, whenever she wants to breastfeed that express breast milk, if it is in winter season, then she has to prepare lukewarm water and keep the keep the container in that lukewarm water so that it will achieve the temperature.
She should not Heat it in microwave.
Never heat. But it can be kept in the lukewarm water so that
It can
it
be
gets the
given otherwise
temperature.
also without warming it also.
Summer is okay, but winter sometimes it can become too cool. And
Suppose the
secondly, we
baby
have
has
to-
taken a small portion of it, and should she keep it back into the refrigerator or should she throw it?
she can keep there only if it is sterile technique. Why she should throw it out?
Now, suppose the baby has taken 2 ounces and another 2 ounces left in the container. What should she do with that 2 ounces? Should she throw it?
It can be kept as such, but
For
covered
how many
one.
hours?
6 to 8, total 6 to 8 hours.
After the baby has taken, it can be only kept for 1 to 2 hours after that. It should
Now
be
next
discarded.
question
It should
to
not
Dr.
be-
Rama Raju. Rama Raju, I have not heard your voice. So Mrs. Rekha, 35-year-old lady, had ICSI babies, but twins, and C-section performed at 38 weeks, means mature baby. What advices you will give her for the breastfeeding, and she has to join office after 4 months?
So she has to start her breastfeeding as early as possible. So that's exclusive breastfeeding. And before going to office, and she has to feed the baby as much as possible, and she can express the milk, and it can be stored. And later on, once the mother
Yes,
can
good.
take-
So the breast pumping can be advised, and the simultaneous breastfeeding in good
Both are
identical
necessary.
twins is also very important.
Football method is the method which
Yeah.
has been advised to twin babies, so there is no partiality whether male baby or female baby.
Yeah,
She
yeah,
can
exactly.
simultaneously feed both the babies by holding
and
the
one
baby's
has to
leg.
keep in mind that once the baby twin one is latched, then only put the baby, the another baby on the breast.
Naturally,
So
but
not
it-
simultaneously.
We are
simultaneously
running
done.
short of time. The next question is Suman, diagnosed with HIV in 24 weeks of pregnancy, refuses breastfeeding because of high risk of vertical transmission. What is your advice? And what drugs would you like to prescribe the mother and the baby at this point of time? Who would like to take this question?
Actually, our national guidelines has
Baby should be
recommended-
given nevirapine. Yeah, baby should be given nevirapine, and mother. Now many drugs have been come, but most likely zidovudine or
No,
levodopa.
zidovudine is no more being used. It's TLE is being
It's
which
a
is
triple
used
therapy.
globally under NACO guidelines. It is tenofovir, lamivudine, and efavirenz. That is a basic drug which is given to all mothers who are found to be HIV positive, irrespective of the CD4 cell count. And then, would you advise her to breastfeed?
If the baby has taken medicine, then we can.
Sorry?
If the baby has been taken given medicine, then we can advise breastfeeding also.
Or can be advised or should not be advised? What are we following right now? Anybody wants to add to
breastfeeding should
this?
be
Yes, if mother is taking this antiviral therapy during pregnancy, then the vertical transmission is less than 2%. So the national guidelines also say now that if mother is on the treatment, then she can exclusively breastfeed for 6 months and continue the breastfeeding at least for minimum 1 year. Only thing
Depending
is the
upon
counseling is very
depending
important.
upon whether the baby is found positive or not.
Yes.
We
If
will
the
keep on
baby is
doing the early
positive,
infant
there is
diagnosis.
No issue. She can continue the breastfeeding. Only if the baby is
Here-
negative, 3 things we have to remember, that the mother should not get the nipple cracks or candidiasis or mastitis. In those 3 cases, the chances of transfer are more. But otherwise, there is no problem.
Important advice should be the counseling, because it's not we that will decide. It is the mother and the baby, they have to decide. But again, there should not be mixed feeding. If at all she wants to breastfeed, she should
Okay.
exclusively
So we go to the next
breastfeed.
question.
No mixture of breastfeeding and top
Mrs.
feeding.
Yamini, 29 years, 10 days postpartum, refused to take her medicines for fever as she fears that drugs will pass through breast milk and may adversely affect her baby. So what is your advice?
We
Fast,
should,
we'll
yeah,
just
we
go
should
fast.
advise her to continue with the fever treatment, because only few antibiotics, as discussed earlier in the session, that amoxiclave causes necrotizing enterocolitis. Otherwise, only the drugs contraindicated in breastfeeding would be the anti-neoplastic drugs, and some anticonvulsants like lithium and all. They should be avoided in breastfeeding.
So these are the drugs which are actually contraindicated during pregnancy.
Actually, main crux is that whatever infection the mother has got, the antibodies will be produced in the mother's blood. Those will be transmitted to the baby through breast milk. That will protect from the same disease which mother has contracted.
That is what
So
we follow when a
Check.
mother has got
we must
chickenpox
stand.
also.
Yeah. That's
All right,
This is
so
another question. These are the common issues we will not be taking. Should she be put on thyroxine if she has already been taking anti-thyroid drugs when she is lactating?
may I
Generally, requirement decreases after delivery, so we have to repeat T3, T4 and T6.
जानते रहने
Okay.
So may I request the doctor and the panelists, we are